Assalamualaikum candidates. I am Dr. Nadia, gynecologist and online teaching mentor. Now we are discussing today the labor, which is actually a hard work of delivering the baby, starting from the uterine contractions, and ultimately there is delivery of the fetus and there is expulsion of the placenta. So ultimately, the process starts with effacement of the cervix, and ultimately, uterine contractions are there, delivery of the fetus is there. And when the fetus is full term, that is between 37 to 42 weeks, is called as term pregnancy. So the delivery starts, the process starts usually at the term. So third trimester, before labor, it can sometimes happen that there is dislodgement of the mucus plug. So ultimately, this can result in bloody show and ultimately the onset of uterine contractions, or there can be premature rupture of the membranes. So amniotic sac is ruptured and ultimately this results in leaking and this results in onset of the labor. So these all circumstances can result in true labor, leading to uterine contractions and cervical effacement and ultimately delivery of the fetus with the expulsion of the fetus. And before that time, there are usually the false contractions, which are termed as Braxton Hicks contractions. They can simply be termed as Braxton contractions, which are actually of low intensity contractions. So these are usually not frequent, and ultimately we have to assess the frequency. So, however, the true contractions, they progress in their frequency, duration, and intensity, and that is why there is effacement of the cervix and ultimately there is dilatation of the cervix. Now what happens that as we know that once the cervix is there, first of all, once the uterine contractions, which are fundally dominant contractions, they start, and this leads to effacement of the cervix. And after the effacement of the cervix, there is dilatation of the cervix, and this leads to descent of the presenting part. And this ultimately, the true contractions lead to delivery. Now, in the primary Paris patient, usually the duration is 12 to 18 hours for duration. However, in the subsequent pregnancy, this almost comes in this becomes 6 to 9 hours, and or similarly this can vary in the from patient to patient. Now generally we can categorize the labor into first stage, the second stage, and the third stage. Now as far as the first stage of labor is concerned, this is further categorized into two stages, that is the early or the latent phase, or and second one is the active phase. Now the latent phase can be as much as 20 hours. Now during this time, what happens that there is going to be there are going to be twin contractions, irregular contractions. They might be of low intensity, and they can lead to effacement of the cervix, and the contraction they are after every 5 to 30 minutes depending on the intensity, and this in turn can lead to effacement and dilatation of the cervix to about 0 to 3 centimeters, and at this time the cervix is usually 30% effaced. Now this ultimately results in the irregular contractions, and regular contractions results in dilatation of the cervix, with the uterine contractions being strong in intensity, and more frequent contractions, and ultimately leading to dilatation of the cervix, and as much as 6 and 5 centimeters of the cervical dilatation can be there. And at 5 centimeters, according to the new guidelines, we say that now the patient is in labor and she is in the active stage of the labor. Now in the active stage, what happens? The patient dilatation of the cervix is from 6 to 10 centimeters, and ultimately 100% cervix is effaced, and intensity of the uterine contractions is increased, and this can be after every uh, 0.5 to 2 minutes, lasting for about 60 to 90 seconds. So ultimately what happens in the first stage, this it has started from early latent phase and then ending up in the active phase, leading to full dilatation of the cervix and effacement. and ultimately there can be the rupture of amniotic sac, and ultimately there can be further we see the descent of the presenting part. Now coming towards the second stage of the labor, what happens in the second stage of the labor, that this actually defines the pushing stage where the head is delivered. Now before delivery we have to consider the certain we have to consider certain factors. These are that how is the baby's head being presented, that is actually in coordination with the maternal pelvis. So actually three P's must be remembered, that P for power, that is passenger, and passage. Power is actually the uterine contraction, passenger is the fetus, and passage is the cervix. So if there are powerful contractions and fetus is having vertex presentation and passage, that is cervix, is fully dilated, then it is a favorable condition, and definitely there is going to be good labor, and ultimately this has the baby is going to be delivered ultimately. And now passage is actually the cervix as well as the bony pelvis, which the anatomy of the bony pelvis, we should remember that which bones are involved in it. Now in the as far as the delivery of the baby is concerned, so ultimately what happens, that it is actually the presenting diameter is the vertex, that is the diameter is occipito-bregmatic diameter, which is the diameter which can easily be presented through the inlet. And now the fetal size is also to be remembered. Now fetal head, as I have told you, that the diameter should be assessed and its attitude should be taken. Attitude in such a way that it's flexed or it's extended. What type of presentation of the head is there? So fetal attitude is to be determined, and normally what happens, that it is fully flexed, that is the chin is with the chest, and ultimately you can say that it is rounded back and flexed arms and legs. So position also produces the smallest diameter. So the longitudinal as we see here that suboccipital pragmatic diameter is actually the diameter which is the smallest diameter which can allow the fetal head to be presented through the inlet. And however the if it is not fully flexed, then ultimately the larger diameter is there and it will not be easily delivered. Now a fetal lie is also to be assessed. That fetal lie is actually if it is longitudinal, that is fetal spine, so it will be a good pushing factor, and ultimately what will happen, that the delivery will be more easy in this way. So we have seen the fetal size, the attitude, and the lie. All these factors are to be remembered, and they need to be addressed, and ultimately we have to see. However, different presentations, like there can be transverse, or there can be oblique lie, or there can be further longitudinal, as I've told you before. So out of these, the favorable one is the longitudinal lie, which can easily be delivered. Now fetal presentation is also a point to be remembered, that either it is cephalic or it can be breech. So cephalic is the one where we easily deliver the fetus, and here the head is coming first, so it can easily be delivered. But if it is going to be breech presentation, then in that case definitely we have to assess that either this patient is going to be delivered or not, and we have to be very much careful in this regards, that breech delivery is actually a delivery carried out in the hand of experienced obstetrician, because we have to see the descent of the presenting part, and we have to see the after coming head as well. And also the shoulder presentation is very difficult presentation, so ultimately we have to move vigilantly. Now as far as the second stage of labor is concerned, the second stage, as I have told you before, that actually what happens, that there is descent of the labor fetus, and ultimately we have to see the mechanics of labor. That first is the descent, Now, what is descent? There is downward movement of the fetus in the pelvic inlet. Now, first of all, you have to remember the pelvic inlet. That pelvic inlet actually anteriorly is the symphysis pubis and posteriorly is the sacrum, and at the scale spine we have decided the point 0. Now, once the fetal skull is at the level of fetal spine, then it is said to be engaged. So ultimately, it is coming from negative present points towards the towards 0. So ultimately now it is engaged at the level of ischial spine. So engagement is said to be done. So after engagement, first of all was the descent, and then there is engagement, and ultimately what happens that chin is against the chest, and it is actually the flexed presentation. And there is also internal rotation in a way that shoulders, they rotate internally at an angle of 45 degrees. And so internal rotation is going to be there. And further, after that, the fetal is making an attitude favorable for the delivery. And after that, what happens that the descent, the head is undergoing flexion, and furthermore it is descending downward, and then it undergoes extension. And with extension, the baby's head is seen at the vaginal outlet, and ultimately it is going to be delivered. So it emerges through the vagina with extension. And the favorable, as I've told you, presentation was the vertex presentation. And then is the restitution is that head externally rotates and comes in line with the shoulders. And then after that we go for the rotation of the we go for the delivery of the shoulders. And furthermore, then is expulsion. Now interior shoulder is delivered, and then after that we go for the delivery of the rest of the body. Now after interior shoulder we go for the posterior shoulder delivery, and then we deliver the rest of the body. And once making sure that there is no element of dystocia and the fetus is delivered, then we have to go for the third stage of labor. And what is the third stage? Actually, it is the delivery of the placenta. Now the placental delivery is to be has to be carried out very vigilantly, and it is the active management of the third stage of labor, where we have to go for the controlled cord traction, and we have to give the syntocinon to the patient, and also it is removed carefully. And we have to see the signs of the separation of the placenta, and ultimately make sure that placenta is completely removed. So after all these steps being carried out, normally after that we study the fourth stage. What is the fourth stage? The fourth stage is the stage of adaptation, where that adaptation to the blood loss, and there is a start of uterine contraction in involution, because uterus has to come back towards its normal size as well, and for that uterine contractions will be in there. And ultimately, in short, I told you the labor in detail, that it is comprising of the first stage, the second stage, and the third stage. The first stage starts with the contractions ending up in the uterine cervical effacement dilatation, and ultimately full dilatation is there. And in the second stage of the labor, there is pushing, and ultimately ends up with the birth of the baby. And then in the third stage, there is delivery of the placenta, and make sure that there is active management of the third stage of the labor. So this was all about the labor. Thank you very much.